Bacteria of urinary infection. Since the gonococcus, the typhoid bacillus, and the tubercle bacillus have, for obvious reasons, no statistical relation to the other bacteria causing infection of the urinary organs, and since they cause types of infection which are best considered separately, they are not included in the following data. The most recent study of the bacteria found in the infected urinary organs is that of David. The cultures were obtained from cases of infection of various parts of the urinary tract. Aerobes, 23 Bacillus coli, 15 Staphylococcus albus, 3 Staphylococcus aureus, 5 Bacillus enteritidis, 3 Bacillus fiscalis alkaligenes, 2 Bacillus proteus, 2 Bacillus pyocyanus, 1 Streptococcus, 1 Bacillus pseudodiphtheriae, 1 unidentified gram-positive Diplococcus, 1 pneumococcus, 1 influenza-like bacillus. Anaerobes, 4 black pigment-producing bacilli, 4 gram-negative influenza-like bacilli, 2 Staphylococcus parvulus, 1 gram-negative coccus, 1 Bacillus fungiformis, 2 gram-positive Staphylococcus. The relation of the anaerobic bacteria to infection has not yet been determined. We shall consider only the aerobes. It is to be noted that various bacteria may grow simultaneously in the urinary tract. The Bacillus coli is usually a part of such mixed infections. It is further to be noted that certain of the bacteria separately listed in the above table may be grouped. Among the 58 listed aerobes, bacteria of the colon group appear 31 times, 53%, Staphylococci 18 times, 31%, while the remaining bacteria may be classed as infrequent. Scheidemantel examined 100 cases with the following results: 89 colon group, 6 Staphylococci, 3 Proteus, 2 Streptococcus, 2 influenza bacillus and typhoid bacillus, a Diplococcus, and the Pyocyanus each once. This represents quite closely the bacteria found in infections of the renal pelvis, while David's list represents more accurately those of infections of the bladder and prostate. In other words, infections of the renal pelvis result almost always from bacteria of the colon group, while infections of the bladder are much more frequently due to the pyogenic cocci. On the other hand, every writer who has reported bacteriologic investigation on perinephritis has noted the preponderance of the pyogenic cocci in the pus obtained from perinephritic abscess. Though the number of cases reported by any one observer is small, the universal agreement on the preponderance of staphylococci and streptococci in causing perinephritic suppuration is notable. Virulence. The available data do not suggest any particular virulence attributable to any specific bacteria or strain of bacteria. It would seem as though the virulence of bacteria depended most upon the accessory circumstances under which the infection occurs. Footnote: this statement runs counter to all we know of the nature of infections, yet with certain limitations it is true, and it serves to focus the attention of the practitioner upon the surgical features of these infections. Indeed, experiments upon animals have amply proven two facts. In the first place, bacteria may be presented to the kidney in the circulating blood, pass through it, and be found living in the urine, and yet leave behind no trace of their passage. In the second place, bacteria may be injected into any portion of the normal urinary tract and cause no damage whatsoever. Clinical observations have confirmed these findings. Thus, we may say that the occurrence of infection depends upon the simultaneous presence of bacteria and some accessory cause of infection. On the other hand, one of the causes of intense infection is the bacterial splitting up of urea into ammonia and water. The ammonia is an irritant and causes a much more severe infection, ammoniacal infection, then occurs when the urine remains acid. The chief urea-splitting microbes are the Proteus, the pyogenic cocci, and sometimes the typhoid bacillus. These various bacteria show a marked difference in their tendency to split urea. Sometimes they do so, sometimes they do not. The accessory causes of infection have a marked influence in encouraging urea splitting. The colon group of bacteria, with an occasional exception of typhoid bacteria, do not split urea. A marked colon infection gives to the urine the odor of a dead mouse, but does not produce ammonia. Crabtree believes that acute hematogenous kidney infection due to Bacillus coli is a transitory lesion that merely lays the foundation for chronic pyelitis, while suppurating parenchymatous lesions are always due to the pyogenic cocci.